Bonjour à tous. Good morning, everyone. Je suis heureux d'être ici ce matin avec le ministre LeBlanc, ainsi que la Dr Tam et le Dr Njoo. The situation we're facing with COVID-19 remains extremely serious. On Sunday, Ontario reported a record single-day high of new COVID cases. And not just in Ontario, but in many parts of the country, ICU beds in hospitals are filling up, and the patients in them are younger and younger. This is not the place anyone wanted to be right now, because when hospitals fill up, it puts pressure on nurses, doctors, and all healthcare workers. And it means that operations or treatments have to be canceled or postponed, like for people who are waiting for cancer surgery. We're not out of the woods yet with this virus. Everyone is working around the clock to get as many Canadians vaccinated as quickly as possible. But right now, more contagious and dangerous variants are spreading and threatening the progress we've made. Even with millions of Canadians already having received their first dose, we need to keep doing what we know works to stop the spread of the virus. So avoid gatherings, stay home when you can, wear a mask, keep your distance, and download and use the COVID Alert app. We know what it takes to stop this wave. We know how to get out of it. We've done it before. We just need to hang in there, be careful, and protect our loved ones, protect our essential workers, do the right thing so we can get to a summer that is better than right now. Today, I also want to address teachers, parents, and kids across the country. Yesterday, Premier Ford announced that schools will close in-person learning indefinitely as cases of COVID-19 rise sharply in Ontario. And we know that other provinces are watching the situation in their schools, too. I know this isn't easy. So to teachers, parents, and kids, thank you for your efforts once again. You are stepping up in incredible ways, and I know it's tough. Nobody wants to go back to online learning. Nobody wants to be stuck at home. But we have to make it through this, and things will get better because of what we're all doing right now. Since the beginning of the crisis, we've invested $2 billion through the Safe Return to Class Fund to help provinces and territories make your schools safer. And we will continue to do whatever it takes for as long as it takes to get us through this. Jusqu'à maintenant, on a livré plus de 11,3 millions de doses de vaccins contre la COVID-19 aux provinces et aux territoires. Pour ce qui est de Pfizer, cette semaine, comme prévu, on a reçu un peu plus d'1 million de doses. Pour ce qui est de Moderna, une livraison de 850 000 doses a atterri au Canada ce matin. La vaccination progresse. Chaque jour, il y a plus en plus de gens qui reçoivent leur dose. Mais ça n'empêche pas qu'il faut continuer de se protéger les uns les autres en suivant les conseils de la santé publique. Avec ces variants, les cas durant cette troisième vague se propagent très rapidement. On est tous tannés de la COVID-19. Avec les événements des dernières nuits à Montréal et ailleurs dans le pays, on voit que des gens ils sont de plus en plus frustrés. Mais quand on ne respecte pas les consignes de la santé publique, on ne fait que prolonger la situation. Et on veut sortir de cette troisième vague, tout le monde veut sortir de cette troisième vague le plus rapidement possible. On doit continuer nos efforts pour sauver des vies et pour aider nos travailleurs de santé qui sont débordés. Encore quelques semaines de se retenir, de suivre les instructions de santé publique, de faire très attention, et on peut avoir de l'espoir d'avoir un été beaucoup meilleur. Mais comme vous savez, les cas qu'on a aujourd'hui, c'est basé sur des actions qu'on a prises il y a une semaine, il y a 2 semaines. Et si on veut que dans 2 semaines, on puisse voir les cas baisser, bien, il faut faire les bonnes choses aujourd'hui. Les vaccins arrivent, mais il faut réduire les cas aussi. D'ici la fin de juin, on va avoir 44 millions de doses de vaccins. Alors, c'est surtout pas le moment de lâcher. Il faut aplatir la courbe. Depuis le début de la crise, on parle souvent des travailleurs essentiels. Que ce soit dans nos hôpitaux, dans nos écoles ou ailleurs, ces travailleurs font des efforts incroyables. Et quand on parle de travail essentiel, ça inclut bien sûr le travail crucial de nos agriculteurs qui nous permettent de mettre la nourriture de qualité sur nos tables. Une des choses que la pandémie nous a démontré, c'est à quel point il est important d'avoir un secteur agricole fort et résilient. Alors qu'on continue de travailler sur la relance économique, on veut s'assurer que les producteurs canadiens sous gestion de l'offre aient les outils nécessaires pour réussir. There are thousands of poultry and egg farms in Canada. A lot of them are owned by families. Last year, we promised those families that we would invest over $690 million over 10 years to provide full and fair compensation to Canada's chicken, turkey, and egg farmers following the CPTPP trade agreement. Later today, Minister Bibeau will share details about how this funding will help producers invest to modernize their farms and how it will help promote Canadian-made products here at home. But the bottom line is this: our government will always be there for Canadian farmers. So to farmers, thank you for your incredibly hard work. You stepped up during this pandemic to get good food on our plates. Through this pandemic and beyond, we've got your back. Together, we'll continue to build a sustainable future for rural farm families and for all the Canadians who rely on you every single day. Anyone who's seen the endless miles of wheat and canola as they drive across the country can tell you just how big Canada is. In a country like ours, air travel is an essential service. On that front, yesterday, Deputy Prime Minister Freeland and Minister Alghabra announced that we've reached an agreement with Air Canada to secure air travel for Canadians for the future. The conditions for Air Canada to receive this support are very clear. They will ensure that regional communities have air connections to the rest of Canada. They will refund their customers for pandemic-related cancellations. They will commit to protect jobs, pensions, and collective agreements. And they will restrict executive compensation, buy back shares, and dividends. Air Canada will also have to demonstrate how they will support environmental sustainability and national climate goals. The deal is a good and fair deal in the interests of jobs, workers, communities, and customers. L'entente annoncée hier avec Air Canada va protéger les emplois, garder nos communautés connectées et assurer que les passagers soient remboursés. Le secteur aérien est un secteur stratégique pour notre économie et nos négociations avec les autres transporteurs aériens se poursuivent. Comme toujours, on va s'assurer de mettre les intérêts des Canadiens et des travailleurs au cœur de tout ce qu'on fait. This past year has been tough. There have been a lot of special moments and celebrations that have been done differently. Yesterday, I had the chance to speak virtually with Sikh healthcare professionals from across Canada to celebrate Vaisakhi and Sikh Heritage Month and to thank them for everything they do. Happy Vaisakhi to everyone celebrating. This week also marks the start of Ramadan. I want to take this opportunity to thank the many Muslim Canadians who continue to work hard on the front lines and the many others who are helping their neighbors and communities during these difficult times. Cette année encore, le Ramadan va être bien différent. Il faudra se servir des moyens virtuels pour se réunir en ligne plutôt qu'en personne. Mais une chose est certaine, la pandémie ne nous empêchera pas de célébrer les valeurs de gratitude, de compassion et de générosité qui sont au cœur des communautés musulmanes et qui sont partagées par des Canadiens de tous les horizons. Ramadan Mubarak, merci. Je suis maintenant content de céder la parole à la Dr. Tam and to say congratulations, Theresa. I think you just received your vaccine as well. That's good news.
Bonjour à toutes et à tous. As we continue to track current surveillance data against the longer-range modeling forecast from just over 2 weeks ago, we are seeing daily cases still rising along a strong resurgence trajectory. Although COVID-19 vaccine benefits are being seen for high-risk groups prioritized during the initial rollout, experience worldwide is unequivocal in cautioning us that strict public health measures will continue to be crucial during this phase of vaccine rollout, especially in the presence of high rates of disease. To date, over 1,071,000 cases of COVID-19, including over 23,350 deaths, have been reported in Canada. Over the past week, there has been a 33% rise in daily case counts, with an average of almost 8,100 new cases reported daily. During the same time, the number of people experiencing severe and critical illness continues to rise. On average, over 3,000 people with COVID-19 were being treated in our hospitals each day, representing a 29% increase over last week. This includes almost 970 people being treated in intensive care units, which is a 24% higher than last week. Although the number of deaths has averaged around 30 each day for several weeks, there is concern that if the increase in severe illnesses persists, we could see a gradual increase in the mortality trend, with today's average at 34 deaths daily over the past week. Today's average at 34 deaths daily over the past week. There are almost 36,000 variants of concern cases reporting to date across Canada, with the B117 variant accounting for over 96% of these. These trends are discouraging, but they reinforce why we must strengthen precautions to bring this variant of concern-driven resurgence under control quickly. This is a third big push, and we're all tired, but the benefits of applying our strongest collective effort by following public health advice and strictly maintaining individual precautions could not be greater. This push will enable us to focus more capacity towards vaccine rollout. Two great examples of this unified effort I will highlight today are from Nova Scotia. We have recently learned of a vaccine clinic organized for Black Nova Scotians in the Hammonds Plains community, just outside of Halifax. The clinic was held at the historic Emmanuel Baptist Church, which has long been an important fixture in the community. Coming together in solidarity to receive COVID-19 vaccines is a testimony to the community's perseverance and commitment to ensuring people feel culturally safe in the vaccination process. I also heard about a pharmacist in Cape Breton who converted an old ambulance into a mobile clinic to bring COVID-19 vaccination to seniors and people with mobility challenges. There are so many examples from individuals to organizations finding ways to help others and make sure that we all end this crisis together, stronger and more united. Finally, on our current trajectory, it might seem premature to think of the days when restrictions will ease and social and economic activities will resume. But if we want to take forward the things we've learned about the importance of family, community, and equity, about how we supported each other, adapted, and innovated, we must commit to acting thoughtfully, clear in the view of what we want to take forward. The end of this crisis will be a time of great change. Let's not race towards the finish and risk stumbling along the way. Let's make every step count by continuing at pace together. Thank you.
Bonjour à toutes et à tous. Alors que nous continuons d'assurer le suivi des données de surveillance actuelles par rapport aux prévisions modélisées à long terme établies il y a un peu plus de 2 semaines, nous constatons que le nombre quotidien de cas augmente toujours selon une trajectoire liée à une forte recrudescence. Bien que nous remarquons les avantages de la vaccination contre la COVID-19 chez les groupes à risque élevé vaccinés en priorité lors de la campagne initiale, ceux qui passent partout dans le monde nous mettent en garde sans équivoque quant à la nécessité de maintenir des mesures de santé publique rigoureuses pendant la présente campagne de vaccination, particulièrement en présence de taux élevés de maladie. À ce jour, plus de 1,071 000 cas de COVID-19, dont plus de 23 350 décès ont été recensés au Canada. Au cours de la dernière semaine, le nombre quotidien de nouveaux cas a augmenté de 33 en moyenne presque 8 100 nouveaux cas étant signalés chaque jour. Au cours de la même période, le nombre de cas graves et critiques de la maladie continue d'augmenter. En moyenne, près de 3 000 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, soit une augmentation de 29 par rapport à la semaine dernière. Ce chiffre comprend presque 970 personnes qui étaient dans des unités de soins intensifs, ce qui représente une augmentation d'environ 24 par rapport à la semaine dernière. Bien que le nombre de décès s'élève en moyenne à environ 30 par jour depuis plusieurs semaines, nous craignons que si le nombre de cas graves continue d'augmenter, cela pourrait se traduire par une augmentation graduelle du taux de mortalité. Nous avons enregistré une moyenne de 34 décès par jour au cours de la dernière semaine. Il y a presque 36 000 cas de variants préoccupants signalés à ce jour au Canada, le variant B117 représentant plus de 96 des cas. Ces tendances sont source de découragement, mais elles démontrent pourquoi nous devons prendre des mesures de précaution encore plus rigoureuses afin de maîtriser rapidement cette recrudescence liée aux variants préoccupants. C'est notre troisième série d'efforts importants et nous sommes tous fatigués, mais les bénéfices que nous obtiendrons en nous serrant les coudes comme jamais auparavant, en respectant le Conseil de santé publique et en appliquant rigoureusement les précautions individuelles seront les plus importants à ce jour. Les efforts que nous déploierons nous permettront d'affecter davantage de ressources à la campagne de vaccination. Les deux exemples de solidarité que nous mentionnerons aujourd'hui ont eu lieu en Nouvelle-Écosse. Nous avons appris récemment qu'une clinique de vaccination a été organisée à l'intention de la communauté noire néo-écossaise à Hammond Plains, en périphérie de Halifax. La clinique s'est déroulée dans l'église baptiste historique Emmanuel, qui fait partie intégrante de la communauté depuis longtemps. Ce geste de solidarité dans le cadre de la vaccination contre la COVID-19 témoigne de la persévérance et de l'engagement de la communauté en permettant aux personnes de recevoir le vaccin dans le respect de leur culture. Nous avons également été informés qu'un pharmacien de Cap-Breton a converti une ancienne ambulance en clinique mobile pour permettre aux aînés et aux personnes à mobilité réduite de se faire vacciner contre la COVID-19. Les exemples sont si nombreux de gens et d'organisations qui innovent pour aider les autres à veiller à ce que nous sortions de cette crise ensemble, plus forts et plus unis. Finalement, compte tenu de la trajectoire actuelle de la courbe, il pourrait être prématuré de songer au moment où les restrictions seront allégées et où les activités économiques et sociales reprendront. Cependant, si nous voulons mettre à profit ce que nous avons appris sur l'importance de la famille, de la communauté et de l'équité, sur comment nous avons pris soin les uns des autres, nous nous sommes adaptés et avons innové, nous devons nous engager à agir de façon réfléchie, en sachant clairement quelles leçons nous désirons en tirer. Cette crise laissera place à une période de changement important. Ne nous hâtons pas trop vite, car nous risquerions de rencontrer des obstacles. Passons chaque étape une à la fois en continuant de faire des choses tous en même temps. Merci.
Thank you, Dr. Njoo. The PM will be answering questions for 20 minutes. Minister LeBlanc and doctors will remain available for more questions for another 15 minutes afterwards. One question, one follow-up, starting with the phone. Merci beaucoup, Dr. Njoo. Le premier ministre va répondre aux questions pendant 20 minutes et doit nous quitter par la suite. Le ministre LeBlanc et les docteurs répondront à d'autres questions par la suite pour un total de 15 minutes. Une question, une sous-question, en commençant par le téléphone. Opérateur, c'est à vous.
Merci. Thank you. Please press star one if you have a question. Veuillez appuyer sur étoile 1 pour poser une question. Notre première question est de l'inaudible de la presse canadienne. À vous la parole. Please go ahead.
Oui, bonjour. J'aimerais savoir si les derniers développements sur le vaccin de Johnson & Johnson changent quelque chose à notre intention de commander les 10 millions de doses. Est-ce que ça retarde le contrat ou est-ce qu'on attend encore les premières doses fin avril?
Merci, Lina. On est dû pour recevoir nos premières doses de Johnson Johnson à la fin du mois d'avril. Mais évidemment, on va continuer de regarder attentivement ce qui se passe aux États-Unis avec leur expérience. On continue d'être en discussion avec la compagnie et de comparer nos données avec tous nos partenaires. Mais Santé Canada va toujours prendre les bonnes décisions pour assurer la sécurité de tout le monde. Et c'est aussi un exemple de pourquoi c'est une bonne chose qu'on ait tellement de différents contrats avec différentes compagnies de vaccins, parce que même sans Johnson Johnson, on va avoir plus de 44 millions de doses d'ici la fin du mois de juin. C'est important d'avoir plusieurs options et c'est exactement ce qu'on a.
Donc, si je comprends bien...
Juste une seconde, Lina, je vais répondre en anglais d'abord.
Allez.
We are still on track to receiving our first shipment of the Johnson Johnson Janssen vaccine by the end of this month. But obviously, we're following closely developments in the United States, and we can assure everyone that Health Canada will, every step of the way, put the health of Canadians first and foremost in any decisions we make around distributing vaccines. But it also goes to highlight that it was important that we signed deals with a large range of potential vaccine makers because we didn't know which ones would be most effective, which ones would arrive early. That's why Canadians are well served, and even without the Johnson Johnson vaccine, we are going to be receiving over 44 million doses by the end of June.
En suivi, Lina?
Merci. Donc, dommage que Mme Manan ne soit pas là, mais si je comprends bien, on ne touchera pas au contrat, ça ne changera rien. On va quand même acheter les 10 millions de doses et décider entre-temps si on les administre ou pas, si jamais il y a un problème. Est-ce que c'est comme ça que ça marche?
On a signé des contrats avec 7 différentes compagnies à travers le monde l'année passée pour justement s'assurer que, quelles que soient les compagnies qui livraient le meilleur vaccin ou un vaccin efficace rapidement, nous allions être bien positionnés. Donc oui, on a un contrat, on a acheté des doses de Johnson Johnson et on espère que ça va être des doses qu'on pourra utiliser pour protéger les Canadiens de la COVID, mais on va prendre nos décisions basées sur les recommandations de Santé Canada, basées sur ce qu'eux y concluent par rapport à ce qu'ils voient dans le monde.
Merci. Opératrice, prochaine question.
Merci. Our next question is from Ryan Tumulty from the National Post. Please go ahead. À vous la parole.
Yeah, good morning, sir. I'm wondering, obviously with the benefit of hindsight, but, we're in the middle of this third wave now, and vaccines wouldn't solve it, but they certainly do some way to help address its impact. Is there anything about our vaccine procurement approach as a country that you, in retrospect, now think was a mistake, or where you would have liked to have acted earlier?
No, not in terms of our vaccine rollout. Obviously, we worked extremely hard from last summer onwards to sign many different contracts with different potential vaccine makers around the world. And we were among the first countries to start getting approved vaccines into arms back in December. We've seen various vaccine companies challenged with development or manufacturing issues. But in general, the vaccines have been arriving in Canada in steadily increasing numbers. And I think it's important to remember that vaccination alone, even being well advanced in vaccinations, doesn't necessarily lead to an ability to ease public restrictions. Just look at the case of the UK, where they obviously have a higher rate of vaccination than we have, but they also have significant restrictions and have kept them in place for quite a long time. What we need in order to ease restrictions in this country as we get closer to the summer is both for more people to get vaccinated and for the caseloads to go down across the country. Those are the two things we need to make sure happens. And restricting caseloads or reducing caseloads has to do with following public health advice, restricting our movement, limiting gatherings, wearing a mask, washing your hands, doing all those things that we know will reduce the number of cases around the country, because we've succeeded in doing it before in the second wave and way back in the first wave as well.
Following up, Ryan?
Yeah, sir. The third wave that we're seeing now is worse than it has been at any point during the pandemic for some parts of the country. I'm wondering if now, especially as these cases continue to rise, if you're considering any tighter restrictions from the federal level, either restrictions between travel at provinces or maybe more restrictions on incoming travel from overseas.
On incoming travel from overseas, we already have some of the strongest restrictions in the world and have had those in place since last March for well over a year now. The 2-week mandatory quarantine on essential travelers, the limits on non-essential travel, now the testing, the pre-boarding testing, the on-arrival testing, the mandatory quarantine while we're waiting for the results of the tests, and the 2-week quarantine in a safe situation at home are all things that have meant extremely limited importation of the virus from overseas. Unfortunately, we're still getting a lot of transmission inside the country, and that is something that we need to continue to monitor. But that's not something that the federal government needs to step up on. The extraordinarily successful example of the Atlantic bubble, for example, was done without the federal government dictating to the Atlantic provinces that they needed to do this. They made that decision on their own, and it was the right one. And of course, as a federal government, we supported them. Similar things for the Northern Territories. We are there to support the provinces as they make difficult decisions on restrictions. And part of why we're making those decisions easier is by providing unprecedented supports for small businesses, for workers, for families, for seniors, for young people, to make sure that people can stay home and stay safe if it's at all possible, to keep those essential workers safer.
Merci. Opératrice, une dernière question au téléphone, s'il vous plaît.
Thank you. Notre prochaine question est de Marie Vastel du Devoir. À vous la parole. Please go ahead.
Oui, bonjour. En fait, j'avais une question sur le vaccin Johnson & Johnson et l'utilisation des doses, là, quand même, dans 2 semaines, si je comprends bien.
C'est Dr. Njoo. Peut-être moi, je peux commencer. Dr. Tam peut ajouter après. Oui, on sait que nos collègues à Santé Canada sont indépendants. Ils suivent les situations étroitement et ils continuent d'avoir des bonnes discussions, conversations avec leurs homologues des États-Unis. Et c'est sûr, ils vont analyser les données et ils vont aussi prendre une décision peut-être pour ce qui est important dans le contexte canadien. Donc, je pense qu'ils travaillent à l'heure actuelle et c'est pas pour nous autres ici à la santé publique, à l'Agence de santé publique du Canada pour commenter sur le travail de Santé Canada.
En suivi,
Dr. Tam, oui. Comme vous avez déjà vu, Santé Canada a un processus très rigoureux. Il va suivre, je pense qu'à peu près le même processus que la détection de problèmes avec
You can go in English if you want, Dr. Tam. I'm sorry I asked it in French, but you can go in English.
Thank you. It's okay. So I think you have seen the process once already that the regulator in Health Canada follows when there is a signal of an adverse effect following immunization with the AstraZeneca vaccine. So I expect them to do the same due diligence connecting to the international regulatory authorities like the Food and Drug Administration in the United States and gather information from them as well as the manufacturer We've heard about rare side effects. I think it's 6 cases of these unusual blood clots with low platelets following 6.8 million doses administered in the United States. Health Canada, we need all of this data and do, in the Canadian context, the benefit and risk analysis. Following that, I expect that the National Advisory Committee on Immunization, as appropriate, will look at that information as it supports the provinces and territories in providing guidance. And I would also expect to convene and support a discussion amongst provinces and territories as to how best use the Janssen vaccine in the Canadian context. So all those steps I expect will be followed similar to the AstraZeneca vaccine.
En suivi, Marie?
Well, thank you. Just a quick follow-up, Dr. Tam. When do you expect Health Canada to have done this analysis and come out with an opinion on this? Et M. Trudeau, en sous-question, on voit que la France suspend tous ses vols avec le Brésil parce que la pandémie y est essentiellement hors de contrôle. Je sais que les Canadiens ne devraient pas voyager, que c'est pas le temps de voyager, donc je vous évite de me répéter ça en réponse à ma question. Je voudrais savoir, est-ce que vous comptez au Canada demander la fin des vols avec le Brésil ou est-ce que c'est déjà fait et est-ce que vous envisagez faire la même chose avec d'autres pays?
D'abord, on est en train de regarder très attentivement ce qui se passe à l'international et on va prendre des décisions au fur et à mesure qu'il y a plus d'informations qui rentrent. On a déjà restreint énormément de vols à l'international et on a des mesures extrêmement rigoureuses aux frontières pour assurer qu'il n'y a pas d'importation du virus de nulle part parce que la variante du Brésil ne se trouve pas seulement au Brésil, il y a même quelques cas au Canada déjà. Alors, tout ce qu'on est en train de faire est effectivement pour limiter la transmission. Alors, non seulement ce n'est pas le moment de voyager à l'international, ce n'est pas vraiment un moment pour voyager à l'intérieur de notre pays non plus. Donc, faites attention pendant encore plusieurs semaines, mais on va continuer de suivre la situation.
Merci. On va maintenant passer à les questions dans la salle.
That's available. I'm wondering what you say to Canadians who are at a higher risk of blood clots or who have other complications that may prevent them from getting vaccinated. Is that still the right messaging around vaccine hesitancy when many Canadians have legitimate questions about in the face of conflicting information?
Medical professionals, whether it's your family doctor, whether it's your pharmacist, whether it's the National Guidelines Committee, NACI, are making recommendations around which vaccines are right for which people. That means that gets translated into whichever vaccine you are offered is going to be the right one for you.
J'aimerais vous entendre sur la situation à l'Université Laurentienne. On a vu hier que les programmes en français sont particulièrement affectés. Question spécifique. D'abord, qu'est-ce que vous en avez pensé? Mais est-ce que vous êtes prêt à prendre le téléphone, faire pression? Et êtes-vous prêt à offrir, au besoin, une aide financière pour que les programmes soient rétablis?
D'abord, nous sommes très préoccupés par la situation à l'Université Laurentienne. La communauté francophone en Ontario est justement a raison d'être très fière de ces institutions d'éducation postsecondaire francophone dans la province. Et nous allons regarder attentivement ce qui se passe. Je peux vous assurer que la ministre Joly est en contact avec son homologue dans le gouvernement de l'Ontario pour voir c'est quoi leur plan pour protéger cette institution importante. Et oui, le gouvernement fédéral sera là pour aider, mais c'est au provincial d'établir la marche à suivre. Mais on va être là comme on a été là pour le gouvernement, pour l'Université francophone de l'Ontario il y a quelques années. On va être là. Obviously, I'm very concerned with what has happened, the reports of what is going on at Laurentian University. Our Francophone institutions, particularly for minority communities like Franco-Ontarians, are extremely important that we protect. I can assure you that Minister Joly, the Minister of Official Languages, has reached out to her counterparts in the Ford government, in the Ontario government, to see what their plan is to support and protect this institution. The federal government will be there to support, but it is a provincial jurisdiction, and therefore they need to figure out what the plan is, and we will be there to support because we know how important it is to protect official language minorities across the country.
J'aimerais vous entendre sur le Grand Prix de F1 à Montréal. Je voudrais avoir vos impressions sur la tenue de l'événement comme tel, mais aussi les promoteurs demandent aux différents paliers de gouvernement 6 millions de dollars en contribution parce que, les spectateurs ne sont pas là, etc. Est-ce que vous avez de l'ouverture à les aider? L'industrie touristique, notamment, a subi des durs coups. Alors, j'aimerais vous entendre là-dessus.
Je sais que les pourparlers sont en train de se passer présentement, mais à chaque étape, notre priorité, ça va être la santé des Canadiens et c'est sur cette base-là qu'on va prendre les décisions. On va laisser les pourparlers se passer et on va regarder qu'est-ce qu'il faut faire pour protéger la santé des Canadiens.
Merci. Prochaine question.
Glenn McGregor, CTV News. And Prime Minister, this weekend your party overwhelmingly endorsed the idea of implementing a universal basic income. Today you're meeting with the leaders of the NDP and the Green parties who also both strongly support that idea. You seem less enthusiastic yourself. Can you clarify your position on this? And as you bring in the federal budget, are you going to take the first steps, or is it something you're going to push off to your next mandate?
I know people are eager to find out what's in the budget, but they're going to have to wait until next Monday for us to put forward an ambitious budget for this country that is going to be focused on jobs and growth and building back better even as we get through these hopefully final stages of the pandemic. I was incredibly pleased to see Liberals gathering virtually from across the country to talk about what building back better looks like, how we can create good jobs and growth, protect the environment, and support the most vulnerable around the country that we've seen have been particularly hard hit by the pandemic. The Liberal Party conventions have been a source of ideas and initiatives that often have made it into platforms and into policy by the Liberal government. I can think of same-sex marriage. I can think of a range of issues that have been brought forward, and we will continue to listen to the grassroots and value their encouragements to continue pursuing various policy options. The things that we've done for the most vulnerable Canadians, whether it's been supporting the middle class and people working hard to join it with things like the Canada Child Benefit, support for seniors by increasing the guaranteed income supplement, reducing taxes on the middle class and raising them the wealthiest 1%, are all things designed to make sure that everyone has a real and fair shot to succeed. And that's exactly what we're going to continue to work on as a party.
Prochaine question.
Hi, David Thurton, CBC News. Prime Minister, you had a lot to say about all the work that your government has been doing during this pandemic to provide benefits for Canadians. But the Bloc and even the NDP is saying that you wouldn't have been so generous had it not been for them pushing you and that you would have done the minimum to help Canadians. Do you agree with that?
It is the role of political parties to try and make themselves look as good as they can. And as relevant as they can. It is the role of a government to be there to support Canadians. And I made a very straightforward promise at the beginning of this pandemic that we would have people's backs, that we would be there for Canadians as much as it took for as long as it took to get through this pandemic. Not just because it's the right thing to do morally to be there for each other, but also because it is the smart thing to do to ensure that our economy can come roaring back as quickly as possible after this pandemic. And this is about us as a government being true to the values and the principles that we have led with over the past 5 years. Whether it was the very first thing we did was lower taxes for the middle class and raise them on the wealthiest 1%. Whether it was the fact that we moved forward with the Canada Child Benefit that lifted hundreds of thousands of kids out of poverty, has made a huge difference in the lives of Canadians. The NDP voted against the Canada Child Benefit. We've continued to move forward on lifting seniors out of poverty. We lifted over 1 million Canadians out of poverty in the first 5 years of our government. at the same time as we created 1 million jobs. The focus we have as a government is on growing the economy and creating opportunities for Canadians, but we know the best way to do that is to make sure that those opportunities are there for everyone. So I'm always happy to see the NDP and the Bloc and the Greens and others supporting the strong measures that we're putting forward. I'm always happy to disagree with the Conservatives when they say that we should have done less for people and more for businesses, because investing in people is something that has demonstrated positive results, not just for Canadians across the country, but for our economy as well, before this pandemic and through this pandemic.
We'll take one last question on the phone. On the floor, please.
Hi, Prime Minister. Chris Reynolds, Canadian Press. Bill C-19, the legislation that would amend the Canada Elections Act to allow a federal election to play out safely and smoothly during a pandemic. This bill has not yet passed second reading in the House of Commons. I'm wondering if you will commit here today to not ask to dissolve Parliament until that legislation is passed, or otherwise trigger an election.
As I've said many times, our priority as a government is being there to support Canadians, being there to give them the supports that they need to get through this. A great example of that is the Fall Economic Statement that put forward significant measures to support Canadian families and workers through this difficult time. Unfortunately, the Conservative Party, amongst others, have been blocking this piece of legislation and preventing that help from getting out to Canadians. That's really disappointing. We need to have a government and a parliament that functions to deliver the supports to Canadians they have, not to have parties play political games. So we're going to stay focused on making sure that Parliament is working for Canadians. And part of that is ensuring that we do move forward on important initiatives like the C-19, the Pandemic Safe Elections Act, which would allow for a federal election to be safer in a pandemic situation. Obviously, nobody wants to have an election right now. Certainly we do not. But I think it is simply responsible to make sure that parties have the choice, for example, to vote against the budget we're putting forward next week and not feel threatened that democracy is so fragile that we can't have an election because they would be putting Canadians at risk. That's why we're disappointed that even though we've brought forward, I think 5 different times, if not more, the Elections Act for debate, it hasn't been able to move forward. We hope that parties are going to put aside their political differences and allow debate and discussion to happen at committee on the Elections Act, because we need to have a parliament that functions, but first and foremost, we need to be delivering for Canadians as we're in this third wave, and we're going to do everything we need to get Canadians the support they have to have while we bring forward a budget, while we move forward on direct supports for Canadians. Depuis les débuts, j'ai fait la promesse que nous allions être là pour les Canadiens, aussi longtemps que ça prendrait, avec toutes les ressources que ça prendrait. On va passer à travers cette pandémie. Pour cela, il faut pouvoir livrer à la Chambre des communes sur les mesures nécessaires pour les Canadiens. Et malheureusement, par exemple, notre énoncé économique de l'automne est encore en train d'être retenu à la Chambre des communes par le Parti conservateur, qui est en train de bloquer de l'aide aux Canadiens. C'est décevant qu'ils jouent des jeux politiques avec des enjeux extrêmement importants pour les Canadiens. Nous, notre priorité, c'est de livrer. Notre priorité, c'est d'assurer qu'on est là pour appuyer les Canadiens. Les autres partis jouent de temps en temps des jeux politiques. C'est comme ça que ça se passe. C'est normal, c'est sain dans une démocratie. Mais quand vient la question d'aider les gens, ou quand vient la question d'assurer que des élections que personne ne veut, mais qui pourraient se passer dans une démocratie, soient le plus sécuritaire possible, j'espère que les autres partis vont permettre le passage de ce projet de loi pour assurer que si on a des élections pendant une période de pandémie, ce seront des élections qui auront moins de risques pour les Canadiens.
Merci beaucoup, Monsieur le Premier ministre. C'est tout le temps que vous avez avec nous aujourd'hui. On va maintenant retourner au téléphone pour des questions pour le ministre LeBlanc et les docteurs. Opératrice, c'est à vous.
Thank you. Our next question is from Mary Kay Walsh from the Globe and Mail. Please go ahead, à vous la parole.
Hi, thank you so much for taking my questions. I'm looking for more information about Moderna. We're seeing repeated delays in shipments from Moderna. I believe we're now looking at the third delay in a row, with provinces being told to expect the shipment that was expected next week to only arrive the week after at the earliest. The Moderna doses that the Prime Minister announced today are actually the ones that were supposed to come last week. So why is this continuing to happen? And is there any clarity on when more certainty will come to Moderna's supply?
So it's Dominic LeBlanc. I'll offer a few comments, and if Dr. Tam or Dr. Njoo want to add something, they obviously can. We have said from the beginning of the vaccine procurement exercise, because of the nature of the global supply chains, because of the nature of the ramp up that these companies are doing around the world, various vaccine manufacturing sites, obviously desperately trying to maximize their capacity and the output, that there would be from time to time some delays that are inevitable in these processes. My colleague Anita Anand has explained some issues around quality assurance that Moderna wanted to ensure were in place in their vaccine manufacturing facilities in Europe. This explained a slight delay in the Moderna shipments. I think she referred to the doses that were arriving in Canada today. I think that were picked up in Europe yesterday. And we're very confident that Moderna will quickly work out these issues around the quality assurance, which is obviously essential for Canadians in terms of receiving the vaccines. So we're not convinced that this is a long-term or significant change that will endure. It's just something that Moderna explained to us was going to be a reality for a few weeks, but we're very much on track to having all the doses we committed to Canadians to having by the end of June, the 44 million, as Madame Anand and others have discussed.
Following up, Marika?
Yeah, I appreciate that response, but the focus on the end of June does not address the fact that each of these doses are needed now and they're continuing to be delayed. I'm wondering what message you've given to provinces on how much buffer time they need to give to their vaccine appointment bookings because of the uncertainty. For example, Ontario said today that the delays are having an impact on the continuity of their vaccine operations. We saw Manitoba cancel appointments last week because of the Moderna delays. We saw Nova Scotia saying that they're working on a 2-week time frame and only allowing appointments to be booked once deliveries have been confirmed because of the uncertainty. So what's your messages to province on how fast they actually can go right now, given this uncertainty?
So our message to provinces and territories, again, has been consistent that we want to work collaboratively with them and share all of the information that we have as a national government in real time with them as vaccine suppliers, inevitably, as I indicated a few minutes ago, inevitably have some adjustments in certain delivery schedules. So General Fortin, the officials of the Public Health Agency of Canada, distribute the best up-to-date information that we have with our partners in provinces and territories. But we share the very real impatience of Canadians to get vaccinated. That's why we've been able to accelerate over 22 million doses of vaccines that were initially expected to arrive in subsequent months. We've been able to accelerate their arrival to an earlier point, and we'll continue to work in that regard relentlessly to do everything we can to get as many doses in Canada as quickly as we can. So that's something that we've committed to do for Canadians, and that's something that we work on with provinces and territories. But we're very confident that provinces and territories have the appropriate systems in place in order to be able to effectively and quickly deliver these doses to Canadians as soon as they arrive in Canada.
Not having other questions on the phone, we'll now go back to the floor. First question.
Dr. Tam, I would like to get your thoughts about holding the Montreal Grand Prix in closed circuit and especially about the quarantines. Would you be open to kind of a bubble so the pilot wouldn't have to respect the quarantine because they can't respect the 14 days quarantine because of the previous event? Where are you at in that reflection? Et Dr. Njoo, si vous voulez ajouter quelque chose en français, je le prendrai aussi.
C'est Dr. Njoo. Peut-être moi je peux commencer. Moi, je suis un peu plus impliqué que Dr. Tam avec tous les sports. C'est intéressant. Nous autres, on travaille étroitement aussi avec nos collègues aussi à travers le gouvernement fédéral parce que même le dossier pour peut-être les exemptions pour les événements, c'est aussi avec les autres ministères, l'immigration aussi et patrimoine. Donc, on travaille étroitement avec eux. Mais moi, avec nos collègues à l'Agence de la santé publique, notre rôle, c'est vraiment d'analyser les protocoles. C'est quoi le protocole pour dépistage, pour peut-être une quarantaine. Mais comme le premier ministre a constaté déjà, pour nous autres aussi, en fin de compte, c'est vraiment il faut assurer la sécurité et la santé des Canadiens. Ça, c'est la priorité. Et donc, on est toujours en mesure de regarder, analyser les soumissions, les propositions des organisateurs des événements avec la sécurité et santé des Canadiens comme une priorité. Maintenant, je peux vous dire que il y a beaucoup de monde aussi, le gouvernement de Québec, qui sont en train d'analyser les protocoles, mais je ne suis pas dans une position pour vous dire plus que ça. C'est quelque chose, c'est un enjeu actuel.
Par ailleurs, est-ce que vous pouvez me dire précisément où vous en êtes sur cette idée? J'aimerais savoir un peu une idée d'où vous vous positionnez. Est-ce que vous sentez qu'il y a une ouverture, d'une part? D'autre part, qu'est-ce que vous pensez de cette bulle qui permettrait aux gens qui y participent d'éviter la quarantaine?
Je ne sais pas, je comprends bien éviter la quarantaine. C'est sûr que tout le monde qui rentre au Canada normalement, et c'est normal pour tous les voyageurs qui arrivent au Canada de passer une quarantaine de 14 jours. Des fois, peut-être on peut donner un exemple. Moi, je peux peut-être donner, comme il dit un avis, un conseil personnel. Des fois, c'est un défi parce que si on analyse un protocole, c'est la même situation, même avec moi, je me souviens des champions de hockey mondial pour les juniors. Hein. Donc, on a analysé les protocoles, la proposition des organisateurs à un moment donné. Mais on a dit toujours, hey, on ne sait pas qu'est-ce qui va se passer au futur. C'est quoi les situations, quelle sera la situation quand l'événement va vraiment se passer. C'est la même chose maintenant avec le Formule 1. C'est encore dans quelques mois. Et maintenant, on est vraiment dans une situation très, très préoccupante avec les variants préoccupants, avec les unités de soins intensifs dans plusieurs régions à travers les pays débordés. Donc, si on analyse la situation maintenant, c'est wow, il faut vraiment avoir les restrictions, il faut vraiment avoir les bonnes mesures de santé publique en vigueur. Donc, ce n'est pas le temps de vraiment, pour moi, de penser à des autres événements, mais on ne sait pas qu'est-ce qui va se passer. C'est difficile à planifier aussi un peu au futur, dans 2-3 mois, parce que c'est vraiment la situation maintenant. Il faut vraiment réagir.
Prochaine question.
Glenn McGregor, CTV News. Question for Dr. Tam. We've seen other politicians getting their vaccines on camera. providing a lot of information about it. Your office sent out a black and white photo and won't say even what vaccine you had. Could you give us a little more information about your vaccination today and what you had and under how you qualified for that shot?
Sure. Of course, I'm very happy, like most people who have had a COVID-19 vaccine, that I actually got my shot. What I did was I went online and filled in a registration according to Ottawa Public Health and the Ottawa Hospitals protocols. I wasn't sure, I filled in the questionnaire and I await their respond back to me as to whether this is the time for me. So I did get a response back, and I lined up for my vaccine like everyone else. I didn't know exactly which vaccine I was going to get until I received the electronic email that provided me with information ahead of time as to what all the information every person who receives a vaccine should get. I knew around that time that I was going to get the Pfizer vaccine, and I lined up for it. I was obviously reading about it while I was lining up, and that's what I received.
Thank you. We'll get the next question on the floor.
Abigail Beeman, Global News. I'm just wondering, in light of changing information around vaccination, whether you think that you're doing enough to combat vaccine hesitancy, especially from Canadians who have legitimate questions about that, beyond just telling everybody to get vaccinated.
I'll offer a few comments. Oh, and then Dr. Tam can add. We talked to provinces and territories about this very issue many times. In the First Minister's call that the Prime Minister had last week, he again spoke with other First Ministers around the importance of working together to combat vaccine hesitancy. Also, the importance of directing Canadians to reliable information from different health authorities around vaccination. There is a significant amount of disinformation circulating. The best way to combat that is to empower Canadians to have access to reliable scientific information from independent scientific authorities and public health professionals. That's the best way to reassure Canadians that the vaccines are safe and effective. And we'll continue to work with provinces and territories and the medical community across the country to do whatever we can to enhance public confidence in something that we believe is entirely safe and very effective. But Dr. Tam and Dr. Njoo can probably add more.
Thank you for this question. It's an extremely important aspect of rolling out the vaccine programs. As you've seen, there's many different surveys looking at whether people intend to be to get the vaccine. And I think the latest survey suggests that like 80% of Canadians plan to get the vaccine, but many of them still have questions, particularly about safety. And those have to be addressed straight on. And so, as Minister LeBlanc has said, enabling healthcare providers to provide those specific answers is very important. So, what we're trying to do is provide the tools that they need, training, webinars, including any new developments, such as we've just seen in the rare cases of clotting with low blood platelets, is something that we try to get out to health professionals and different organizations as well that may be communicating with people in Canada about getting the vaccine. We have been supporting some funding to enable trusted community level organizations to try and get information across to their communities. I gave a couple of examples, including churches, church leaders, Black Canadians taking their place in terms of helping out and getting the information to their communities because they are more trusted by the communities who've experienced health inequities. And so getting to the people who communities and individual trusts is very much part of that strategy. Indigenous leadership. I think we need to highlight just how important that has been in getting so many First Nations communities and the territories having such a successful approach in getting people vaccinated. I do think that there is more to be done, whether it's through social media and other channels to reach the younger age groups, because soon they will be in that space. Working with workplaces, we've heard workplaces also working with local level and provincial level programs to help get their workers vaccinated, offering their workplaces so that there's increased access. So access is really important. It's not just a matter of people having questions about the vaccine, but can you get the vaccine to them as efficiently as possible? So all of those different approaches need to all be done depending on your local situation.
We'll take one last question before ending this presser today.
Hi, Dr. Tam. This is Chris Reynolds with Canadian Press. Since we have limited time, a double-barreled question for you. First of all, I'm wondering, with the record number of patients in ICUs, but death toll that's well below the record numbers, is that because of the vaccines? And secondly, with the clotting events largely happening to women, why isn't advice around AstraZeneca gender-specific? Thanks.
Yes, on the first question. Now I've almost forgotten it. So let's start with the last question. So I think Health Canada has requested through their terms and conditions for authorizations specific information from AstraZeneca for the Canadian context, which means they would have also asked for the age and sex breakdown of cases so that we can analyze them. But these are rare events, so it's very difficult when the case numbers are quite unstable. The rates, when you have a very rare event over a large denominator, to try and get a handle of that. But in the end, what is actually really important is to look at the rates of severe outcomes in different age groups. This might change depending on your jurisdiction, but also with the rising cases and increased numbers of severe outcomes in younger populations, the analysis on the impact of COVID-19 also has to be taken into account when you look at that benefit and risk analysis. So the data is moving both in terms of the disaggregate data for the rare adverse event and on the COVID-related impacts. So that analysis will be undertaken by the regulator, but also by the National Advisory Committee on Immunization. And provinces also do that, looking at their own specific context, as well as their vaccine supply. And that will be sort of re-articulated in the coming days. So we look forward to that kind of data. At the last round, there wasn't enough information to essentially distinguish whether there's any sex difference in terms of the risk. But we'll await and see what the next analysis shows. In terms of the, I think it was on the rising rates of severe outcomes. So deaths, it was an incredible sort of heartening, I think, result to see the rates decreasing in those over 80 as they were the first to become offered the vaccine. And the rates of long-term care facility outbreaks go down quite dramatically, together with a number of cases in those populations. At the same time, of course, there's been public health measures, infection control measures being applied, but we do believe the vaccine has had an impact and has been effective in reducing severe outcomes in those who were initially prioritized. So what we'll be watching carefully on is, well, what happens in the next age group, for example, and those other priority groups that receive the vaccine. There's some very good data suggesting that health workers that have been initially vaccinated, first of all, with the one dose, has had really good vaccine effectiveness. And so all the vaccines that we have protects against severe outcomes really well. But what I would say is that death or mortality is still a lagging indicator, as I've said in my opening remarks. So when we see ICU cases going up, as well as hospitalizations, I do not know what is going to happen in another number of days to do in terms of the deaths and who are implicated in that very severe outcome. Still, I think most deaths still occur in the older populations, but we will see.
Merci beaucoup, Dr. Tam. C'est ce qui m'a fait la conférence de presse aujourd'hui. Thank you.